To enable prevention, we follow the patients. That's the key thing, that if you don't follow the patients do not adhere to proper therapies and do not continue to take their medications. Studies have shown that taking the proper cardiac medications can reduce cardiac mortality by as much as 80%. But if the patients are not seen, if they're not followed, if they're not reminded, monitored, supervised, and if the medications are not renewed, then the patients will not adhere to medication. In addition, we reinforce lifestyle measures, weight reduction, physical activity level, exercise duration, smoking cessation. Applying all of these measures, again, can reduce cardiac mortality by as much as 80%. The Continuing Medical Implementation website provides multiple tools for patients, for patient education, and for physicians for applying the broad range of medical knowledge. It's paradoxical that although we have a lot of research and a lot of knowledge and a lot of guidelines, that it is not all necessarily applied continuously. And part of that is logistical. In fact, most of it is logistical. The sheer burden of continuing to do the same thing over and over and reminding the patients to adhere to medications, to follow guidelines. And part of the problem as well is that the guidelines keep changing and we have to keep adjusting our practice. So hence a medical education concept will deal with a momentary bit of information, but a medical implementation process, a continuing medical implementation process will provide a mechanism to maintain cardiovascular health on a long-term basis. We encounter a lot of information that our patients bring to us from the web that is sometimes reliable and sometimes not. And what I really wanted to do was to preempt the patients by providing them with a high-quality source of information so that they could start there before they go elsewhere. And that information is available not just to our patients, but across Canada and around the world. The site receives about 250,000 visitors a year with over 2 million downloads of various information sheets on an annual basis. You could go to Continuing Medical Implementation and download books that would provide you with a full summary of cardiovascular disease and prevention, a full summary of heart failure management, various diet sheets, virtually any diet you need to manage your cardiovascular well-being. You could download information to help you decide whether or not to accept various treatments to prevent stroke, to prevent heart attack, and review these with your family doctor. This site provides tools not just for the patient, but for the family physician to aid them in making decisions and working with the patient to come up with decisions to manage their cardiovascular health. So the net result is that we do have a lot of cardiac patients who are actually pretty well and pretty elderly. And that's the reason why our elderly practice is growing, because the patients just keep surviving. I'm a member of the OAC, and I'm on the executive of the OAC because I believe it's important for cardiologists in Ontario to protect their patients from ill-advised reductions in healthcare funding. The only group that is going to advocate on your behalf is the Ontario Association of Cardiologists, which has not only your best interests at heart, but the best interests of your patients and the people of Ontario.